afternoon, everyone. Thank you for joining me again for another session. And today I have somebody that is a little bit special to me, a friend and a public health journalist. His name is David Arume, all the way from Niger State. So it's a very, very far distance, but I'm so glad we could eventually hold our session. It's been a whole lot of back and forth, but then eventually we are holding the session. All right. So David Arume is with me today. Okay, let me just allow him introduce himself in few seconds. Let's get to meet you, David Arume.
Hi, thank you, Dr. Dakola, for having me, and thank you for this opportunity. Just a quick one. My name is David Arome. I'm a public health researcher and also a journalist. Just a quick background of myself. I'm a graduate from University of Jos, where I obtained bachelor degree in science laboratory technology and specialized in physiology and pharmacology. Then I proceed to regular in American University where I obtained a master's in public health. So um, it has been like an intersection between research and journalism. So that's what I do now, basically. I do research and I also do journalism. So that is just part of me. And I've done a couple of publications. I have plenty publications, international journals, and also stories. My stories, though my bit of coverage is in health, um, human rights, gender issue,
Okay.
and environmental health. Thank you.
Okay, thank you very much. One of the things that fascinates me is that your line of work is not a very common one. And I want you to kind of tell us how you were able to get a niche in public health journalism slash research. From your academic background, you said you graduated from University of Jos, where you had your first degree in science laboratory technology, if I'm correct, and you specialized in physiology and pharmacology, right? So
Very well.
I want you to kind of walk us through how you were able to. Is it like there was a particular degree or anything you did that eventually led you into journalism, public health journalism? Like, how did you kind of find your way in this thing you're currently doing?
All right. Thank you very much. Okay. How I find my way here is a very long journey, but it all started right from my primary secondary school, and
Okay.
I'm this type that like research passion. I like research and all of that. And this really informed my decision in terms of build up in that regard. So starting from secondary school, though that passion was there, but there was no platform for me to really work on. So it was when I got to university. So precisely during my final year. Okay, before
Okay.
then, during my IT, when I was doing my industrial attachments at the NIPRID in Abuja, and so it was just the platform I needed to really explode, and I saw that opportunity and then dive into it. And one of the things that also really triggered me in moving, I'm talking about the research now, was my supervisor, Dr. Ifoma Bidike. She's one of the greatest motivators, if there is any, that has been a driving force. So she saw the passion in me and she now took interest. So from there, I began to learn and all of that. So within that night read, that is where I was grounded. I became grounded in research and all of that. So it's not just because what we're doing there was we're working with research fellows, because they're doing a lot of research and all of that. So beyond what they do, beyond the bench work, me, I go extra
Okay.
mile, I go extra mile to analyze the results of each of the work we do, then also try to interpret the results. So I'll do that on my own, not being told. I'll do that. I'll now go and submit it to my supervisor. She will look at it
Okay.
and now like say, this is amazing. So it all started that way. So at my final year, I was my research was on malaria, anti-malaria and property of lemongrass. And we were like 10 that were working on anti-malaria property but different plant extracts. And so it's all the project undergraduate project was a walkover for me because it's something I have done over and over. It's something I knew very well. And so when my supervisor say, "Oh, it's actually malaria," I was just laughing because it was a walkover thing for me. So I did
Okay.
that. Then after school, even when I was doing that, I was even working for doing it for other students. I was doing their
Okay.
projects for them. So all these ones widened my experience. And even after school, I have to stay for 2 years. After school, I have to stay for a year. Yes, before I went for internship, I have to stay for some time, a year. And I was working with one associate professor in farm camp, Dr. Folabi. So one of his master students was also working on the anti-malaria. Um, yes, so you now say, oh, David take over. So that was how I was working within that space. So my full establishment was within the academic space when I was still in school. Then after leaving school, I see a gap because one of the gap I see is a lot of research is being done, but how to communicate those findings
Okay.
to the audience beyond the academic environment where such publications is being posted. Like now, if um, after doing a research, maybe on um, after doing a research, I now post it on, let's say, on LinkedIn, not LinkedIn, on Facebook. People will not even understand it. Some of like those
Yeah.
scientific words and so it's people will not even that interest to even read the yeah the article is not even there. So what I started doing was I I was trying to what I did was I tried to break it down to a very simple term that a layman can understand. So
Okay.
I started that way. I just continue doing that way. Then till I think 2020 or so. Yeah, 2020. And I saw one opportunity. It was for an intern. That was health news. That was the first place I
Okay.
started. But this opportunity for intern, not intern that are interested in health journalism and all of that. So I just put in my
So
application.
this is where journalism comes in, right?
Yeah, yeah. So I now saw that opportunity. So I now put in my application. So I now got it. So from there, I began to write. I began to write, do publications, and that is how I then ventured into journalism. So it was a seamless switch. Is it switch or I would say diversification? It's diversification, I would say, because I'm not digressing. So that is how I got into this space. So it's I'm still doing both, combination of both. So it's like dropping somebody in academic space. I can function very well. Putting me in journalism space, I can function
Yeah.
very well. Humanitarian space, I can function very well. So that is how I find
Okay.
myself.
That's
research.
great. And that's awesome. So for,
Thank you.
let's say, for an undergraduate that wants to work this pathway now, is there like a straightforward link into public health journalism, something like that? Is there anything like that, or is it just you looking out for opportunities that can launch you into this? Or
Okay,
what would
for
be the best of advice for such a person? I
okay,
really love your path, your career path. So I'm concerned about people that would want to probably venture into something similar. How do they navigate it?
okay. Coming into the public health journalism space. Uh, Before I answer that question, I just want to say the journalism itself is very broad, and there are different beats in
Okay.
journalism. So, one of the things that for younger people that have that interest to really navigate into the public health journalism space is one of the things I'll say is passion for it. That is number one, having passion for it. So if that passion is there and the opportunity is always there where one can really navigate. So how is that possible? So like if you want to start, one of the things I'll advise for anyone, younger people that want to start, is you start by volunteering. You can volunteer to any of those media houses. You can write to
Okay.
them and tell them that, okay, introduce yourself to them that, okay, yes, you really like, you want to really navigate into the public health space or health space in general, and you just want to be voluntary for them, and also for them to also nurture you into it. So by the time you write to them, because different organizations, different media houses have their bits of coverage. So there are some there are some that is basically focused on health. There are some that covers more than two, three bits. There are some that is just one bit. So it's just to get those media organization that covers that bit of health. Then
Okay.
you reach out. Yes, you reach out to them. The truth is, someone said, I can't remember the name. He said the best journalist is not those who read mass communication in school, and that is very true. I've seen it. Yes, it's not those who read mass communication in school. Yes.
Okay.
So with all of this, it's it makes it seamless for anyone who wants to navigate within that space. And other thing is, journalism is not. People look at it like, it's money making. It's money making. But the truth is, when you come in, when you come in, you really understand how how it works. But in all, it's just that passion. Once that passion is there and you just follow through this process, before you know, you get it. Um,
Okay. I think that would be helpful to anybody that wants to like take this career pathway. Thank you very much. So, when you started your work in journalism, what were the shocking experiences you had? Plus, the fact that you are even working in the northern part of Nigeria. Most of your works are based in the northern part of Nigeria. So, what was it for you? Were you shocked about some things? Can you just tell us your experiences at the onset?
when I started, I think I was still in Abuja with the health news, and it was a volunteering thing. They were not paying me. They weren't paying me at all. So I was just doing the volunteering. It was a bit challenging because then I had to combine doing other field work to also sustain myself because since they were not paying me anything, but it was just a platform for me to build up myself. So starting from that, it was a bit challenging at first because I was trying to because it's like just I'm getting to a new environment, a new working environment where things are not like, oh, this is research, you something that I'm familiar with. So though I was able to scale through all of that. So at that first instance, it was not really that easy, but that passion to really work was really there. So from there, okay, I started growing. Then coming to the north, one of the difficult part of reporting journalism is, I can say, is in the north, because the north itself is ravaged with so many things. And
Okay.
when you talk about insecurity, it's on the high side. When you talk about poverty, it's on the high side.
Yeah.
When you talk about early child marriage, it's on the high
Exactly.
side. Illegal
Inside.
mining is on the high side. Out of school children is on the high side. Malnutrition is on the high side. So it's just like
Wow.
the north. The north is like the headquarter of the other side of of,
There's a lot.
of everything. So it makes it more challenging, especially if you are covering stories, sensitive stories, like if you are doing investigative story, is one of
Okay.
the aspects is one of the aspects of journalism that is very difficult and tasky, that required, you just have to be smart, and you just have to be smart. Like, okay, let me give you an example. I was doing a story of out of school children that left school. Then they now start engaging in mining, illegal mining activity. So
Mm.
once I was doing that story, I know the implication. The implication
Okay.
is some of those miners, people that are using those girls, once they realize that, oh, somebody is coming to interview them, maybe to expose them, they'll go after the person, like coming to interview us, and even getting into the mining sites where those guys is.
Okay.
So one of the strategies I used was to get somebody from that community that they knew very
Okay.
well. Yeah, like a youth leader, somebody that they knew. So I
Okay.
got the person. Yeah, it was through that person I was able to navigate through. Went to the mining site, saw the girls on my camera. I was recording. I was doing everything. Nobody was asking me any question because there was somebody that they knew already, the person that they knew very well in the community. So it's quite demanding. And sometimes if you are doing a story, I remember when early this year, yes, early this year, I was doing one data story. I have to travel
Okay.
down to Benin. And it's not
Okay.
just traveling down to Benin State. I went to like hard to reach communities. I have to spend several hours on bike. Like there's one particular PAC is in Kinshisha. It's a local government in Benin State. It took me 5 hours before I get there. I was on bike for 5 hours before we get to that facility, primary healthcare. So you can see what it really takes for someone to do a story, to get a story. So if if it's not something that, if I'm the person that I'm not interested, if that interest is not there, I'll not even dare it because of the risk involved, traveling that long distance, going through narrow roads where it's just you and a bike man, and the bushes around. You don't know what can really happen at
The
any time.
country.
Exactly, with the insecurity and all of that. So all of these are some of the challenging things. And also the part of another challenging part is the government itself. They are not really helping matters, because some if I'm doing a story, I remember I was doing a story on climate change, how climate change um, is pushing Nigerian farmers to debt and poverty. So I wrote to First of all, I interviewed the chairman of the All Farmers Association, Niger State chapter, then with some of the members. So from there, he now gave me a contact of one of the directors in the State Ministry of Agriculture because I needed to get his own voice to know what government is doing about farmers, the input of the government. So when I called him, he now said that I should write a letter. I should write a letter to the commissioner, that's the commissioner of agriculture. He's commissioner of agriculture. May I know when he said I should write that letter, I know that it's an impossible something. I know that before they will answer you, if they won't answer you at all, it will take like 4 5 months if they will answer you. And my
Wow.
story is not is the story is just for 1 month. I have 1 month period to do that story. So how will I be able to wait that long and it's over? So these are some of the challenges. So sometimes governments they are not helping matters. I don't know why they are hiding things and they don't want to talk. Uh so these are some of the few
Okay.
uh
Okay. Well, definitely, you must have had some memorable experiences that felt so fulfilling for you. Moment that you felt like, wow, this is the major reason why I want to do this, and moment that has kept you on track, even despite the shocking experiences, despite the challenges. Moment that you felt so fulfilled, and you were like, this is the reason why I think I want to do this and I want to continue. Can you share some of those memorable moments with us?
all right. Um there are so many of them, but let me just take it in bits. And
Okay.
the very first one, the story of out of school children I did. Um, so I did like I did like a series on that story. The
Okay.
first one was from classroom to the streets, from classroom to hawking, and second one was from classroom to mining.
Okay.
So I did a series on that, and the exciting part of it is that the first time I saw um, the girls, the girls that were out of school, um, interacting with them, it's really, really pathetic. It's a really pathetic story. So, like, majority of them, most of them, it's either their father or their parents are no more, and they are staying with their own. And because of that, some of the aunts, some of their relatives took their advantage to push them into mining activities, taking them out of school. But the good part of it is one of the memorable experience from this is that story I did and really brought a change. And one of the change I saw
Oh,
was this organization, Roots of Sharon Foundation. So
okay.
with that story, Roots of Sharon Foundation were able to get some of these girls,
Back to
yes,
school.
get yes back to
Wow.
school. So
Wow.
they were paying their
That's
fees, they were paying their they placed them on stipend too. So every
wow.
month, yes, every month. There's even one I was so excited about her. She always dreamt to become a nurse, and I like the part of which it took when the father died. All hope was lost. Rose of Sharon, I spotlighted the story, a story. Rose of Sharon came in, um, right from I think JS2, started paying her fees. She finished, wrote her WAEC, then she now proceed to College of Health Tech. Yes, I think yes,
Okay.
she's still there. So I'm still in touch with her. She's still there. She's doing very well. And There's another one. That one is okay, still in secondary school. So that is where you see your story making an impact, drawing the attention of people or concerned authority or government, and you see that kind of action coming. This one is not even from the government, it's an NGO coming to salvage the situation, picking the girls and from the streets, from the mining site, taking them back to the classroom. So when you see when you read a story and your story, the impact is positive, it makes you feel excited about it. That
This
you're not
these
waiting
are really awesome. These are so awesome. Like these are things that some days you just remember, you just thank God for them. It goes beyond just being a journalist now. Yeah, this is really awesome. Looking at the way media is going on, I feel like you do more of writings in terms of your journalism. Are you considering coming into what do I call it now? The new because mostly now we have more of videos, storytelling is now more of in video forms. Are you seeing yourself in this in the nearest, let's say, 2 3 4 years?
very well. I'm even navigating. Yes, I want to probably next year. I'm looking at multimedia aspect. Though I do some multimedia aspects. Like this story I told you about out of school children to the streets, from the classroom to walking. There's a video component of it.
Okay.
Maybe I'll share with you. You just want it's just a clip. There's a video component.
Okay.
Uh, the
Are we
truth
going to be able
is,
to is it going to be possible to edit it alongside this video? It's a very private video.
don't worry, we'll talk about that after this.
All right, no
So,
problem.
so um, the truth about the reality now is looking at what is happening, especially the Gen Z. Ah, Gen Z people don't have time to be reading stories,
Exactly.
learning
Big
stories, all of
articles
that.
and all those strong lines. Exactly.
As so people don't have that time. So it's something that is very short, just punching, catchy,
Yeah.
straight, conveying the message at just within that split of seconds, conveying the message of the story. So that is what is especially young people really, really are after now. So in media, it is called multimedia
Okay.
reporting. Yes,
Okay.
multimedia. So beyond text, which is the regular one,
Okay.
we also have component of bringing in video,
Okay.
yeah, bringing in video, short clips, then adding it to the story. And most another time is um, getting into like video because all those things has to come with ethics and all of that. Most times, your source, the person, your respondent that you're interviewing, there are some of them that don't want them to get don't want video recording. So
Okay.
it's also a challenge. Yes, in some instances, I will say no. We can we can interview
Because of
me,
the privacy
do
of the
the
story
audio
recording.
recording. Yes, do the audio recording. Don't. I don't want video, and you
Okay.
have no option. The option is expected because if you go ahead and maybe you try to corner and do the video and you now publish the story, and the person can sue you to court. The person can sue you, and definitely the person will win because the consent was please don't do video, just audio and all
Okay.
of that. So yeah, it's something
Okay.
that is there.
Thank you very much. Even though there's still more questions I would have loved to ask, but I feel at this point, anybody that come across this podcast, this video, will to some extent have an idea of what it means being a public health journalist slash being a researcher, and how they can if they want to navigate that particular career path. Because most times I feel like people don't really know other aspects that they can venture into, and most times they've not seen people walk through that, and like they don't know about it. So I'm more particular about the fact that this is going to be a source of encouragement to young career persons in public health. That's the major focus for this podcast. For people that are in public health, let us not all just be doing one same thing, whereas there are a lot of things we could venture into. So I am hoping that this video would get across to such people and it's going to really encourage them. And just as I've always said, I really love your work. I love the fact that it's impactful. It's impactful to the Northerners. Though you may not really see the impact now, but then with time, you already see the impact. But with time, you see more impact, and I'm so sure that it's going to be a rewarding one for you. It's a kind of a legacy work beyond now, beyond the pay. It's something that you always feel grateful to God that you eventually like find your way into. And I want to really thank you for creating time out of your busy schedule. I know how busy your schedule is, so I really do not take it for granted. I really do not so glad to be able to have this session. And hopefully one of this time again we'll just get to have David Arume here again and we'll have a
You're
more
welcome.
elaborate discussion. Thank you very much for your time, David. I'm so grateful. Thank you.
All right, thank you very
Bye.
much for having me.